Welcome to our 37 open mic webinar. The topic for this week that we'll discuss is about the latest trend and innovation in Alzheimer's disease treatment. Now, I know that talking about the science and medicine is a very boring topic for most of the investors. You prefer that I give you the stock ticker to invest in, but due to our fund compliance, I cannot give you the stock ticker. However, if you study the underlying science and medicine, that will give you an edge or an advantage when you pick out this biotech stock. Here, I'm going to share with you a summary of what our leadership team presented today. Today, Dr. Van, who is chairman of our medical and scientific committee, he presented on the topic of Alzheimer's disease innovation. Dr. Van started out by talking about this dreaded condition, Alzheimer's disease, which is a progressive neurodegenerative condition. It is caused by buildup of the amyloid plaque as well as the tangle. And then the plaque and tangle itself started to grow in the patient brain and cause damage to the normal brain structure. The brain structure then die off, and without the brain structure, or put it another way, with the brain structure being damaged, that would manifest as various neurological condition.
As you see here, Alzheimer's disease affect the brain, cause the brain to shrink down. Neuron cells inundated with the plaques and the tau tangles. And the plaques are the amyloid plaque. And you can see on this video animation, we have the plaque, the amyloid plaque, and the tau tangles strangling the neuron cells.
Dr. Van also talked about the statistic for Alzheimer's disease, which is much more prevalent than what you think. Currently, there are 8 million of patients afflicted by Alzheimer's disease, and this figure is expected to increase drastically, which Dr. Van will share with you in the slide.
Alzheimer's disease, as you see on the demographic here, 5.8 Americans are living with Alzheimer's. And by 2050, that number is projected to be up to 14 million people.
Shifting gears, Dr. Van talked about the latest trend and also a treatment for Alzheimer's disease. The bread and butter treatment for patients afflicted by this devastating condition is the acetylcholinesterase inhibitor. These drugs work to slow down the decline of the condition to help patients maintain their neurological function. And the three key acetylcholinesterase inhibitor are Namenda, Aricept, and also the Resilon.
Treatments and outcomes. As you know, current treatments include the most popular medications are Aricept and Namenda, you see listed here. The problem about those medications are that they are only symptomatic relief and not a cure. They only slow down the disease progression, but the disease will continue to progress.
We also then discuss about novel trend and treatment in Alzheimer's disease, and one of that is the recent approval of antibody drug. This drug would pull out the plaque and also tangle from the brain. We discussed the controversial approval of Alzheimer, and we believe that this drug has efficacy of patients suffering from the early stage of the disease, because in early stage of the disease, the patient brain structure is still intact, and by pulling out the plaque and tangle, that would help. But once the brain structure is damaged and the brain itself atrophy or part of the brain die off, then this drug would not have much efficacy. Along with that line of discussion, we also discuss about the various stages of this drug, of how it progressed in the time span of 8 to 12 years.
New medical trends. As you know, recently Biogen has come out with two products that they co-market with Eisai from Japan, the aducanumab and the lecanemab. So those are IV medication that patient receive injection once every month or once every 2 weeks. So you see the stages. You have preclinical, mild, and then moderate stage of Alzheimer, and then severe stage for Alzheimer. And the progression can be as quick as 10 years.
Next type of treatment that we also discussed are the stem cell treatment and stem cell from our last week open mic webinar. If you have not watched that, make sure you click in the link above. In our week open mic webinar, we discussed about the potential good use of stem cell therapy to treat Parkinson's disease, because Parkinson's disease, as we share in our webinar, is due to the damage of a brain structure called the substantia nigra, and these are the area that has the neuron or brain cell making the neurotransmitter called dopamine. And now for Alzheimer's disease, we discussed that the stem cell would replace the neuron, but the challenging part is how to get the neuron to form meaningful connection that comes with experience, and that's a big hurdle. If the company can overcome that, then you're looking at a potential cure, or at least a highly efficacious efficacious solution toward Alzheimer's.
The new innovation, including gene therapy and stem cell therapy. Matter of fact, this month we have study from Sweden regarding stem cell therapy for Parkinson's, which we discussed last week, and also for the Alzheimer dementia condition as well from Sweden.
We also discussed about various lifestyle modification to treat as well as prevent Alzheimer's, like improving your diet, that you can take a Mediterranean diet. Also make sure you exercise, avoid certain bad environmental factors like smoking, because as Dr. Van present, there's a link between smoking and also causation of Alzheimer's disease. Also making sure that you take your medication like blood pressure medication, maintaining your good health, as well as exercising your brain. We discussed about there's this technology called BrainFit, where you can sign up to exercise your brain.
6 ways to prevent Alzheimer, as you see here: exercise, eat Mediterranean diet, change your habits, especially tobacco usage, take your medications, using your brain effectively, whether at your job or brain exercise, and of course, protection against concussion, fall, and of course, disease, cardiovascular disease that can cause stroke that result in what we call vascular dementia. So a lot of people don't realize that nicotine, smoking, or usage can also lead to Alzheimer's disease. The non-pharmacologic approach, including cognitive training and lifestyle changes, and these approaches never too late to start. It can be started at any time, even when you're in your 20 or 30. We should consider initiate this type of training now. And there are also now companies out there that advertise to our population to consider getting brain basically training, such as BrainFit, that you can sign up a membership and get monthly membership with them as well.
If you enjoy our video, make sure you hit the like button, subscribe to our YouTube channel, share it with your friends and your family. Also, just tap, you don't have to smash on the bell notification button so that you can get our video as soon as they are released. Now, the other thing I want to share with you about is that our fund, we have weekly open mic webinar where our leadership team meet, and our chairman of the medical and scientific committee, that is Dr. Van Nguyen, he's a cardiologist, also medical director. And he and our team present on the latest advancement in the life science sector. We cover many niche, many topics, which allow me to gain an advantage in the life science sector. And in knowing so, I can fine-tune my research position and invest in young, innovative companies before they blow up big. Let us capture the tremendous upside in the biotech stock market that will occur in the next few years for you. If you're interested in learning more about our fund, you can check out our website, www.evergrowthinvest.com. You can also reach us by email, info@evergrowthinvest.com, or by phone, 704-957-7746. Reach out to us to see if we are the right fund for you and if you are the right investor for us.